My name's Alison Gilliam. I'm a registered nurse. I'm certified hospice and palliative care nurse, and I am patient care manager here at Haven Hospice. What I'm going to be showing you today is how to properly take vital signs. I'm only going to be showing you 3 of them today, and how you make sure that you identify and treat your patient properly at the same time. First, you want to prepare your equipment, have everything ready, whether you've got your basket to take with you, but you want to have your blood pressure cuff, stethoscope. We're going to be taking your pulse, so you'll need your watch, and then taking a temperature, so I've got a thermometer here. You also, before you get ready, you're going to prepare your equipment, you're going to wash your hands. Since we can't really show that right now, signify washing our hands before you go into any patient's room. When you come in, you're going to take your basket or your equipment with you, and at the time you go in, of course, you always knock on the patient's door or the side of the door before you go in, so that you are being respectful to them. Then as you are getting ready to go in there, you walk in, "Hey, Mrs. Alex, I am Allison. I'm your nurse today, and I'm going to be taking your vital signs." You always want to make sure you introduce yourself, tell them what you're going to be doing. Then, when you say that, also you're going to say, "Now, what is your name?"
Alex.
Okay, and you're also going to look at their wristband. Some places will have their picture on the wall or initials on the wall. You want to verify that you're with the patient that you're supposed to be for several reasons. You want to chart vital signs on the correct patient and not cause doctors or nurses to make a mistake by changing medications because of vitals that wasn't on the correct patient. So first, what we're going to do is we're going to take a blood pressure. You're going to have the patient's either gown or shirt smooth or pulled up away from the area you're going to be in. You're going to line the arrows on the blood pressure cuff up with the artery. And then you're just going to straighten everything out so that you can see and have it ready. Place your stethoscope in your ears so that you can hear well. Stethoscope's going to go right here over the artery, and you're going to just hold it with your 2 fingers. Twist this tight, and you're going to pump it up so that it goes up to around 180. Then you're going to slowly release, and you're listening for a pulse. When that beat starts, that's your top number. Then when it stops beating, that is your bottom number of your blood pressure. Sometimes patients, it's very hard to hear. If you don't get the blood pressure, you want to not immediately take it again, although that's a habit that a lot of nurses and aides get into. You either want to try on the other arm or take some other vital signs and then take it again in just a little bit. At that point, you're going to have your pen and paper. You're going to write down real quick, because if you're like me, you won't remember. So then you're going to take the blood pressure cuff off of the patient. Then you're going to let them know that you're going to be taking their pulse. So just have them rest their arm down. You're going to take 2 fingers. You're going to feel right here over the artery. Go ahead, before you're ready to start counting, you're going to want to feel for it. Sometimes you're going to have a pulse that is erratic, will be there for a little bit, will go away. So you want to make sure you're feeling it well before you're ready to count. So then I always wait until I'm on like a 5 mark of the watch. And then you count each pulse for at least 15 seconds. If you're having a hard time feeling it, it's better for you to just go ahead and count it for the entire minute. That way you do have a full, accurate pulse. If you count it for the 15 seconds, then you'll want to make sure that you multiply it by 4 before you write down the actual pulse that you have. So then we'll write down our pulse. Next thing is, Miss Alex, I'm going to take your temperature. You put a protective cover on it. Everywhere has a different type of thermometer. So it's just depending on the thermometer. You wait until it's set, open up under your tongue and hold tight there. All right, when you put it in, you'll wait until it beeps. Some are longer than others. And then once you have the pulse, of course, you're going to write your pulse down. I mean your temperature, sorry about that. Write your temperature down also. And it's not beeping yet. It's taking its time. While we're still waiting on the temperature to finish, after you're finished with the patient, if you have hand sanitizer in the room, you can go ahead, clean your hands again. Of course, you're going to clean your equipment with whatever's provided, a disinfectant wipe, or some places have a spray. You're going to spray your equipment down. Make sure, just as you do between patients washing your hands, you clean your equipment also. You can't go from one patient to the next patient and not clean it in between. And this is not going to beep, so we're going to go with 96.8, but generally you're going to wait for the beep there. So we're also going to clean our equipment, wash our hands good, not just with a hand sanitizer between. When you do not have the opportunity to have soap and water and paper towels, always use the hand sanitizer. After you have cleaned your equipment, written all your information down, then you follow whatever procedures wherever you're working at. Just to recap, what we did is we went over how to do a blood pressure, take a patient's pulse, and to take their temperature. Always remember that with the patient, you want to identify yourself. You also want to identify who the patient is, verify that you're dealing with the patient that you think you are, so you're charting on the correct patient. You also make sure that you always wash your hands before, after, clean your equipment after every patient. A personal preference of mine is if I don't know who used the equipment before me, I clean the equipment before I even start with my first patient. Other than that, I think that shows us how to take a blood pressure, a pulse, and a temperature.